Hi, everyone, and welcome to the Muslim Sex Podcast. I have some exciting news. I want to let all of you know that I am opening up my office, my private office, where I can see you here in New York, and it will be opening at the end of this month. So this month is now June. So at the end of this month, my office will be up and running, and I would love for you to come in and see me as a patient. So go to V Health, so that is FEMMEVIEHEALTH.com, and sign up to be a member of my concierge gynecology practice. And you can also come to see me for regular visits, or if you have a problem visit, come and see me. I, of course, focus on menopause and sexual health. So if you're having any of those issues, I'd love to see you. And make sure you come in and say hi. I'd love to meet you in person. So also, the retreat is still going on. It'll be happening September 16th through the 23rd, and we only have a few spots left. So if you were thinking about coming to the retreat where we focus on nutrition and sexual health and menopausal health, you need to register today because spots are filling up. And once it's sold out, it will be sold out and we will not be taking any more participants. So make sure you go and register for that as well. Also, as always, please remember to like and share this podcast. Leave me a 5-star review so that it shows up and so that we can get the word out about menopausal and sexual health, as well as intimacy and intimacy coaching. So if you love this podcast, please make sure to leave me a 5-star review. And now on to the episode. I'm an American board certified OBGYN, a mom, a Muslim, and I'm talking about sex. This is the Muslim Sex Podcast. Welcome to the Muslim Sex Podcast. I'm your host, Dr. Sadaf, and this episode is everything you need to know about menopause. So oftentimes I get asked by multiple patients, what exactly is menopause? So in this episode, I'm going to just dive into the basics, nothing crazy. And I think that's going to be really important. So before I get into it, of course, I want to make very clear that this is not any type of medical advice. So, of course, if you're having issues or going through, having hot flashes, night sweats, mood swings, all of those things that can happen in perimenopause and menopause, definitely go seek out a provider that can help you out. And of course, this is not going to be the be all end all. There's so much information out, and especially on social media, there's tons of people out there talking about menopause. And of course, yours truly is one of those people talking about menopause. So definitely not meant to be any type of medical advice. So if you're having any issues, go see your healthcare provider. And of course, this is not religious advice either. So everyone that's been listening to the Muslim Sex Podcast knows that already. And we don't need to mention that. But, if you have any questions about your religion, make sure you speak with your friendly neighborhood religious leader. This is the Muslim Sex Podcast because I just happen to be a Muslim woman that talks about sex. So let's get into it. What exactly is menopause, and how do you even know if you're in it? And how do you know if you're just in perimenopause? So let's talk about it. Like I mentioned before, I get this question all the time, and especially when I'm seeing patients in the clinic because, they've been having symptoms. Perhaps they're having joint pain. Maybe they're having those symptoms that we don't really hear about very much, right? Maybe they're having heart palpitations. Maybe they're experiencing brain fog. Maybe they're gaining weight. All of those things that are starting to really bother them. And they don't have anyone to talk to about it. And they think that, each of those things, they tend to kind of categorize them and separate them like, oh, this must be with my heart. This must be with my joints or my legs. And this must be with my brain. And I don't know why I'm having, I'm so irritable all the time, or why I'm sad and why I'm feeling anxious. And, nobody puts it together for the patient. And so I'm here to tell you that a lot of times those symptoms, when put all together, could be a phase called perimenopause. And now, perimenopause is a time right before menopause. So let's talk about it. What is menopause? Menopause is a time period that you don't have a period for a whole year. Okay, so no period at all for a whole year. After that, we call it postmenopause. And so you shouldn't have any bleeding after that. Now, if you have bleeding after menopause, so important to be evaluated by your doctor, and to make sure. The biggest thing that we worry about with bleeding after menopause is endometrial cancer, right? Cancer of the lining of the uterus. So you want to make sure that that is definitely evaluated, and we make sure that you don't have that. The time period before menopause, so the time period before you don't have a period for a whole year, is called perimenopause. And that length of time can vary for everyone. And I'm going to get into, what's really interesting, I think, is that different ethnicities tend to go through perimenopause for a different length of time. And so I'll go in and I'll talk a little bit about, how they came to that knowledge, and also perhaps why that happens. We're not sure, but we're thinking that it could be things such as systemic racism that could affect and change the DNA. And I'll get into that more. So let's first start with menopause. So we talked already a little bit about what menopause is and what that means. Some of the symptoms that people can have in perimenopause, so the time period right before, again, can be weight gain, can be that genitourinary syndrome of menopause. And now what that is a term that combines all of the changes that happen in the vulva and in the vagina. So you can have the labia shrink, you can have the opening, so the vagina can become less elastic. You can have decreased lubrication. Your bladder, you can feel like you have overactive bladder. There's you can have pain with intercourse because you're not getting lubricated and the vagina isn't as elastic. And due to that, people will sometimes experience pain. And then, if you experience pain for a prolonged period of time, right? Like every time you start to have intercourse, you have pain, then you're going to start to associate sex and pain together. And then you're going to just avoid sex altogether because, why would you want to experience pain? So anything that's not pleasurable is something that your body wants to avoid. So that's something that we'll talk about a little bit as well. And so the genital urinary syndrome menopause deals with any of the genital, sexual, and urinary changes that you experience in perimenopause and menopause. You can also have those cognitive changes that we talked about. So the brain fog, you walk into a room, you're not really sure why you went in there, and then you leave and then you come back and you're like, gosh, I knew that I was about to do something. And then it finally comes to you. Or, you are talking to somebody, you're saying something, you can't remember what you were saying, all of those things, right? These can be changes that are happening in perimenopause. You can, of course, get sleep disturbances. A lot of women say that their sleep is just awful during this time and they're just not able to sleep well at all. You can get mood changes. So, some people who've never had anxiety or depression in their lives, sometimes they'll experience new onset anxiety and depression. And I'll get into why that happens because we have all of these estrogen receptors. So let's just talk a little bit about that. Let's kind of delve into why that happens. And I'll tell you, we have receptors all over our body. So estrogen receptors all over our body, and especially in the brain as well. And actually, there was a study that was done. It was released this year, and it was done by Dr. Mosconi and out of Weill Cornell Medical School. And it was research that was sponsored by the NIH. And what she discovered was that we have these estrogen receptors in our brain, and they really light up during perimenopause timeframe. And what that shows us is that our body is really hungry for estrogen. And as the estrogen in our body goes down, these receptors are lighting up, searching for that estrogen. And a lot of times what happens is that, we didn't know this before. We didn't know this research before, but we're starting to learn more and more about how estrogen affects the brain, affects our thinking, and how it affects our moods. And so what we know is that the hippocampus is responsible for memory, learning, and emotion, and it holds short term memories and transfers them to long term storage in our brains. It's also helpful in processing emotions and dealing with anxiety. The amygdala helps process those emotions, and it also links emotions to memories, learning, and our senses. So, and the hypothalamus manages body temperature, hunger, thirst, mood, sex drive, blood pressure, and sleep. So you can see where estrogen acts on all of these things, right? So if we have low estrogen, it's going to affect our emotions, how we process emotions via the amygdala. If we're having a problem remembering, we're going to think about the hippocampus, and we're going to know that the hippocampus is responsible for our memory, our learning, and our emotions as well. So if we have decreased estrogen on our receptors on that part of our brain, of course, it's going to affect our memory. And then the hypothalamus, of course, is also in the brain, and it helps to manage our temperature, our hunger, our thirst, and mood. So if you are having these hot flashes, these night sweats, and all of this, it's probably due to the fact that we have that decrease in estrogen, and it's affecting the thermoregulation that's done by our brain. And that's why we're starting to experience that. And also, we know that there are other receptors in the brain called candy receptors, and there's a medication that's non-hormonal that came out last year. And the brand name, I don't like to say brand names on here, but the brand name of that is Vioza. And that is good. That's a medication that's good for somebody that, say, doesn't want to take hormones. And for some reason, perhaps they can. Maybe they have, an active cancer that's going on, or they just don't want to do hormones. And so they decide that they want a medication that'll help them with their hot flashes and night sweats. And so they decide to go on that medication. So we'll talk a little bit more about medications a little bit later on, but I kind of wanted to just delve into, what's happening with our brain, with our emotions, and the regulation of our body temperature. Also, we can have thyroid dysfunction, you can have increased bone loss, and we know that that happens, right? We know that we start to lose muscle mass, and as women, we start to lose muscle mass, and also start to lose bone mass as we get further into the perimenopause and menopause. And actually, we start to lose bone mass like in our 30s, unless we're, actively trying to build it up. There is a physician, her name is Dr. Vonda Wright, and she talks a lot about, she coined a term called the musculoskeletal syndrome of menopause, and basically just talking about all the things that can happen in perimenopause and menopause in our skeletal system, in our musculoskeletal system, whether it's joint pain, whether it's the loss of muscle, the loss of bone, and all of these things that are happening. And again, we can get arthralgias like pain. Sometimes women are diagnosed with fibromyalgia, where, it might be perimenopause. It might be our decreasing estrogen that's causing all of those symptoms that are happening. So really important just to be aware of the things that decreasing hormones in our body causes for us. You can also have immune and onset of rheumatologic diseases that you never had before. Another thing about bone loss that I want to mention is that we do have an FDA-approved medication for bone loss, right? And that is to prevent osteoporosis, and that is estrogen. And the key time for somebody to go on estrogen, right? So you can, it is a decision that is made together with your prescriber, whether it's a physician or a nurse practitioner, whoever, and the patient. And what the doctor will do is they'll take a look at the risk versus the benefit. They're going to also take a look at your medical history. And to be honest, for the most part, most women can take hormones if they want. I would definitely suggest that even if you never do hormones, that you at least consider vaginal estrogen, because that vaginal estrogen is going to really, really help you as you get older. I see women way into menopause and I see the structural changes that have occurred in their vulva and how difficult it can be for them to have intercourse. And, this is for women that want to have intercourse, and it's just become very difficult because everything shrinks. And to prevent all that, and you have decreased lubrication, and you have decreased blood flow, and the pH changes, and you have decreased elasticity, all in that vulva, all due to the lack of estrogen. And so to prevent all of that, I would say that even if you decide you never want to do hormones, you would at least do vaginal estrogen, because that's going to be so, so important. And did you know that vaginal estrogen also prevents you from having recurrent bladder infections? And we know as physicians that one of the things that women end up having in the nursing homes is bladder infections, our bladder infections. And those bladder infections, if they go undetected, can lead to sepsis and death. So really, really important that, if you have a parent that's older, or if you have, or you yourself are in perimenopause, menopause, that you consider taking vaginal estrogen. And really, I would just suggest that you just do it. You just take it because it's so, so helpful, and it's really preventative and will help in your vulvar health. So that's really important. Other things that, you can experience in perimenopause that I didn't even mention, right? I haven't even gotten to that yet, is you can have changes in the menstrual cycle. So that actually is probably the most common thing that women come to us during this time frame in their lives, is that their periods start to change, right? So whether it is they start to get periods maybe twice a month, or they start to skip months, this is one of the most common reasons that women come in, and may be the first sign of perimenopause. Of course, you can have those hot flashes and night sweats. Women, like we talked about, those vulvovaginal changes that they notice, lots of sleep disturbances, lots of psychological symptoms, irritability, mood changes, depression, anxiety. Other things we talked about were brain fog, joint pain, bone loss. You can have dry eyes. That's also another less recognized symptom of perimenopause. You can have increased wrinkles due to the loss of the elasticity. Again, that's brought on by estrogen, and the loss of collagen can result in these increased wrinkles. And of course, change in weight distribution. So that, of course, is something else that really bothers women. I'll have a patient come in and they'll say, I am gaining weight and I have no idea why. I'm still exercising. I'm still doing everything that I was doing before. And I just don't understand why I'm gaining weight. And we will get into why that happens. And in fact, I'm going to tell you a little bit of why that happens. So the change in the weight distribution. So what happens is that there is a decrease in estrogen, which leads to the loss of muscle. And that loss of muscle leads to a decrease in metabolism. So the loss of muscle leads to a decrease in metabolism and increase in weight gain. And what we know is that estrogen actually helps decrease abdominal and visceral fat and increase muscle mass. Another way that you can increase your muscle mass is by lifting heavy weights and by doing resistance training. That is going to be really, really helpful in as we go through perimenopause and menopause. So it's going to be super important that we do that weight training with lifting heavier weights. So actually what Dr. Vonda Wright, that orthopedic surgeon, suggests is that instead of using the lighter weights that a lot of people tend to use and doing more repetitions with lighter weights, she suggests using heavier weights and doing less repetition to build up that muscle mass and to build the bone. And so that is really what's important. And we know that as we get older and go through perimenopause and menopause, that it's so important to increase our fiber intake, increase our protein intake, and decrease our sugar. And all of those things will also help with our weight and weight distribution. But what's really important and important to understand is how estrogen really helps promote the building of muscle mass, and also how it prevents osteoporosis. So those are really important things to know and to understand. Let's go into, what are the influencers for the onset of duration of perimenopause and menopause, and what happens. So the things that we know that are non-modifiable, things that we can't change, are our ethnicity, our hormones. Basically, when we go through perimenopause, right, we can't change that. The onset of hot flashes and of genetics. The things that are modifiable are things that we can control, like, for example, our body mass index, how much we weigh, our mood and stress. Sometimes we feel that we can't control our moods, but the answer is actually we can. We don't have to have our emotions dictate how things are going to run. Really learning how to process your emotions and to not suppress them is really, I think, the key in helping to navigate this anxiety and depression and moodiness that happens during perimenopause. And of course, I, would be remiss if I didn't mention the role of estrogen in all of this. And I'll get to estrogen, but I really think that estrogen, unless you have a real contraindication to hormones, I would really suggest that you highly consider hormones in this phase of life, because we have to really think about how we want to age, right? Do we want to be frail and at risk for bone fractures and, be sitting in a nursing home with a UTI and, septic and all of these things? Or, do we want to age gracefully? Do we want to be strong? Do we want to take care of all of our health? Do we want to be mentally strong? Right. And so the decision is really yours to think and really decide if this is something that you want to do as you get older. But, in perimenopause and menopause, estrogen, and you'll see how important hormones are. So let's talk again about ethnicity, and why do I even mention ethnicity? How does that affect perimenopause? So the important thing to know and to understand is that our ethnicity actually does affect how long we go through menopause and what the duration of that is. So not menopause, but perimenopause. So our ethnicity affects the duration of perimenopause for us. Okay. And also what I typically suggest to patients is ask how old your mom was when she went through menopause. And then at least you have some idea. But there are patients, that say were adopted or don't have any connection with their maternal figure. So then, they may not know. But what's important to understand is that there was a study that was done in 1994. It's called the SWAN study. And that was a study that it's a multi-center study. And what they did is they observed the physical, psychological, and biological and social changes that women experienced during their middle years. And what they realized was that based on a person's ethnicity, kind of dictated how long they actually experienced these perimenopausal symptoms for, right? So what they noted was that African Americans experienced perimenopause for about 10 years. Hispanics were about 8.9 years. White women were around 7 years, and Japanese and Chinese women were about 4.8 to 5.4 years. Now, what's really interesting is that why are there these changes, right? Why is it that some women experience perimenopause for a longer period of time as opposed to other women? Well, what they think is that there is something called weathering, and you can look that up. Is that there have been societies that have been colonized or have experienced systemic racism for a prolonged period of time, right? Or societies that have undergone war and experienced trauma. And what they notice is that these individuals that have experienced these major life events, that these events will actually change their DNA. So it will actually shorten their DNA, their telomeres, and make them more susceptible to even certain diseases like high blood pressure, diabetes. We know that in Indian Pakistani cultures that they are more predisposed to heart disease and to diabetes. And the thought is that it was because that they had experienced starvation during the time of the British colonization, the British rule, that when they ruled that not the patients, so the people that were there at that time experienced starvation, and now that their DNA has changed and has made them more at risk for heart disease and diabetes. The same thing goes for the women experiencing perimenopause. And so that's something called weathering. And it's a process by which the trauma alters the DNA and makes those individuals susceptible to not only longer periods of perimenopause, but also increases the risk of high blood pressure and diabetes, like I mentioned before. So that's something important to remember. And I think that is really good for those, say, for physicians, right, that have a patient that come in and we know that the mean age for somebody to go through menopause is 52. The time frame of perimenopause can range from 45 to 55. So if, a patient comes to me and she is, let's say she's Hispanic, and she's telling me that she's having, this joint ache, these dry eyes, she doesn't feel like herself, she knows there's something going on, I'm going to keep in the back of my mind that, hey, she might be going through perimenopause because of all these symptoms she's experiencing. And also the fact that, let's say she's 45, right? So I know that Hispanic women can actually experience perimenopause for about 9 years. And if the mean age for somebody to go through menopause is 52, then this patient might be going through perimenopause, which is probably the case and is the reason why she's having the dry eyes, perhaps the moodiness, the night sweats, the hot flashes, all of those things that she may be experiencing as due to the decline in estrogen that she's having in her body. The hormonal shifts that happen also are really important to understand as well. So we have hormones such as estrogen, progesterone, and testosterone in our bodies. And it's really important to not put a gender on these hormones because we have all of them. We have testosterone, we have progesterone, we have estrogen, and we know the role of these hormones. So for estrogen, we know that it promotes the health of the female organs. It promotes elasticity, blood flow, and moisture, and lubrication for the vagina. It prevents osteoporosis. It preserves our bone density. It stimulates growth of breast tissue, and it causes the uterus, the lining of the uterus, to thicken. We also know that progesterone helps with, of course, pregnancy, but it also prepares the lining of the uterus for fertilized egg. It prevents endometrial cancer. It also helps with sleep and cognitive function. So progesterone, is also a very important hormone. Testosterone, we know that it's key to producing estrogen. It contributes to libido and helps to maintain bone and muscle mass. So really important to know, at least have some idea what these hormones do and what the functions they have in our bodies. And then, now that we know what functions they carry in our body, we can look to what may happen when these hormones actually decline, right? So when we have these hormones decrease, we can see that in our bodies during the midlife changes to hormones, we see that women may experience some bloating, some breast tenderness, some heavy bleeding. They can also experience the hot flashes, the night sweats, all of those symptoms that I mentioned already that happen with perimenopause. You can have insomnia, you can have fatigue, you can have this bone loss, you can have vaginal dryness. With low progesterone, you're looking at perhaps irregular, heavier, longer periods during perimenopause. You can have sleep disturbances, you can have mood changes, loss of bone density, migraines, any of those things can happen. And of course, with low testosterone, we see a decrease in muscle mass, and a lot of women will experience decreased libido in this phase of their life. A lot of women will also think that this is just a normal thing that happens. that they just lose interest and they just don't want to have intercourse anymore. And what I want women to know is that, menopause does not mean abstinence. You don't have to get rid of that part of your life, that intimacy portion of your life, unless that's what you desire. So if that's what you want and you're good with that, that's totally fine. But it's not something that has to be that way. So I think that that's really important to know and understand. And well, I'm going to stop here for right now. I want you to take a listen to part 2 of this talk about Menopause 101. And we'll talk a little bit more as to what happens in perimenopause and menopause. So stay tuned and listen to part 2. It's been real and been really intimate. And remember, this is not meant to be any type of medical advice. So if you're having any issues with your sexual health, please see your sexual health provider. And until next time, this is the Muslim Sex Podcast. So thank you for listening to the podcast, and make sure you leave us a review, share and like the podcast. And if you leave me a review, I'd love to shout you out on social media. So be sure that you share it with all your friends. And thanks for listening.